Jaw or chin surgery is not the only option to have a better definition or better contour of the jawline. Many people are looking for non-surgical options to better their jawlines. I am Dr. Shilpi Bhadani. I am a plastic and aesthetic surgeon at SB Aesthetics, Gurugram, India. In this video, we shall be discussing what are those non-invasive options or non-surgical options that can give you a good definition of your jawline. Number one on my list would be fillers. Now, hyaluronic acid fillers are a good way in which we can achieve the definition of the chin and the angle of the jaw. When we are considering fillers, these are injections which can be done in an office treatment, and here we put numbing cream which is for about 40 to 45 minutes, and that helps you through the procedure to make it painless. And when we are assessing the jawline, we have to see where exactly is the definition lacking, or is it the whole jawline that needs to be treated. So obviously, chin makes an important part of the jawline, and when we start at the jaw, obviously we are wanting to define this angle. For many people, they lose this definition over time and with age. For a lot of them, they don't have this definition from the start. In both these cases, fillers can be a good addition to have a definition of the jawline. So we can start at the angle, we can deposit filler at the angle, and then along this part of the mandible, the border of the mandible, along the lower border of the mandible, and then we can go on to the chin, and the entire jawline can be defined with hyaluronic acid fillers. These fillers are special fillers which are not soft, and they can give or stand out actually and give definition to the jawline. Now, when I talk about fillers, these are typically long-lasting fillers. They don't go away so quickly, and they last almost a year to year and a half. But I always tell my patients that if you want to have that contoured look continued, so you can get a top-up around 9 or 10 months, and that will keep your look as it is. And obviously, the amount that is done in the first session, you may not need to do the entire amount again if you give a top-up in between. So obviously, now let's look at what actually is the determining factor of a good result versus an average or not so good result. So we have to assess the skin quality, and it is very important for any filler treatment actually that your skin quality has to be assessed. If you have a lot of laxity or loose skin around, then obviously the amount of filler needed will be huge, and you may not at the end achieve your desired result. So obviously, if your skin is very lax, then there has to be a non-invasive procedure to lift the face. So thread lift comes in handy, and there are different threads. Again, because there are different threads, the lasting of the threads are also different for different threads that we use. But yes, if the skin is very lax, then we need to start lifting the tissue first, and then we can contour with the fillers. A very important part of the definition of the face when we are doing the jawline for, let's say, some middle-aged person is also the cheekbone. So if we highlight the cheekbone with fillers and then again do the contouring of the jaw, the results become actually superlative. So obviously we have to see what is the requirement, and if it's a young person with good quality skin, jawline contouring alone or sometimes even angle contouring alone can provide a very good or the wow factor in your results. But if you have lax skin or loose skin and other areas of your face also wanting attention, then obviously for a wow factor, we will need to look at the other areas also. So another area which is a major determinant of how your jawline looks is your area under your chin or the double chin. So many people are looking for non-invasive options for this also. They don't want to go for a double chin liposuction. In those cases, we can definitely have injections that dissolve the fat cells over there and have reduction of the fat under the chin area. Obviously, if there's too much fat, then the non-surgical results will maybe not match up to the surgical results, but it can definitely be better with a few sessions. If you're looking for non-invasive or surgical contouring for your jawline, and if you have questions, please drop them in the comment box below. If you like the video, do share it with your friends and subscribe to our channel. Thank you.